Well, good afternoon, everyone. Thank you for joining us on this warm Thursday. We are excited to bring to you our June training, aligning the 10 essential public health services with the AFPHS 6Cs framework to support equitable, healthy aging. And wanted to just introduce myself. I'm Karan Phillips. I'm joined today by two of my colleagues, Dr. Bianca Merritt and Megan Wolf. And we would definitely want to acknowledge that the AFPHS movement would not be possible without generous support and partnership from our wonderful funders, the Johnny Harper Foundation. So just a little gentle reminder to please keep yourselves on mute during the presentations. Feel free throughout the entire session to put your questions in the chat. There will be time at the end for questions. And as you conclude the session today, you will be prompted to complete a post-training survey. We would ask you to please give us your honest information and thoughts about the training. We do review this information and use it to help us prepare upcoming training. So we look forward to you sharing your thoughts with us. And so this training will pop up at the end once you exit out of the session. As most of you know, and for those of you that are new, welcome. TIFA is a public health policy research and advocacy organization dedicated to optimal health for every person and individual. TIFA produces several reports annually, including our Ready or Not report, which focuses on emergency preparedness and pain in the nation. And related to our healthy aging, we have produced several reports on topics including housing and rural healthy aging, and including the report that we will be discussing today. For our 2020 trainings, we will be focusing on topics related to equity. We will share how equity intersects with other key topics and how they support healthy aging. Equity is the center of our framework, our 6Cs framework, which again, you'll see featured throughout this presentation today. And today's training is focused on our brief entitled, How the 10 Essential Public Health Services Align with the AFPHS 6Cs framework to support healthy aging. There will be a QR code throughout the presentation, and I will make sure to post a link in the chat shortly to the actual brief for those of you that are interested. But I also want to make sure I introduce our speakers. A little biased that they're two of my favorite people. We'll start our presentation off today, our training off today with a presentation from Director of Policy here at TIFA, Dr. Bianca Merritt, who will do some grounding and setting the context around the 10 essential public health services. And then Megan Wolf will highlight where the intersections of the 10 essential services are with our AFPHS 6Cs framework. So without further delay, I will turn the microphone over to them.
Great. Thank you, Dr. Phillips, and thank you to everyone for joining us today. We're really excited to share a little bit of the structure and framework for this brief that is available publicly, but that really aims to align, as Karan shared, two key frameworks that are critical for advancing the work of age-friendly public health systems. So I'll start by grounding us in the 10 essential public health services. And this is a concept that was developed at least a couple of decades ago, that really highlights a set of key fundamental public health activities. And as we've alluded to so far, right now, the 10 essential services have been grounded and regrounded, I guess, in the concept of equity. And so initially it was developed as a way to inform public health planning across all specialties in the field. So really accounting for, assessment, evaluation, research, policy tools, workforce development, and making sure that people, regardless of where they fit in the public health infrastructure ecosystem, can really see themselves in this work. The core principles have been a key part of accreditation through the Public Health Accreditation Board. So a really critical component of not just how do we think about public health broadly, but importantly, how do we align that with the mission, the activities, and goals of health departments. As I alluded to, this framework has been around for several years, but it was revised in 2020 with the idea of centering equity across all these parts of the 10 essential services. Next slide, please. So I mentioned before there are three key components to this work. Curious before we jump in, how many of folks here, you can either show your hand or do it in the reactions in Zoom. How many of you have heard of the 10 essential services or are generally familiar with the idea? Great. So we do have some folks who've heard of the concept of the 10 essential services, which is great. Um, has anyone here relied on them for accreditation purposes? Show of hands again. Okay, got a couple of folks. Also curious about, has anyone, especially since they've revised the framework to focus on health equity, has anyone here relied on this framework to think about health equity as it relates to these services? So got a couple of folks. So thank you to those of you who've used this work before, because that makes this conversation a little easier. Those who haven't, I think what that tells us though, of those who have, it really tells us about the value, the impact of the 10 essential services. So I did want to take a little bit of time to break down the graphic that you just saw and kind of align that with some of the key activities. So there might be things that you have done based on the list of 10 essential services that maybe you haven't done it formally through your job, but there might be something here that aligns with not just the 10 essential services, but your day-to-day work. So on the assessment piece, there's a lot of focus on assessment and monitoring of population health, investigating, diagnosing, and addressing health hazards and root causes, and communicating effectively to inform and educate people about public health, both issues, opportunities, challenges, um, and really thinking about that from a research, evaluation, and surveillance perspective. With policy development, there's a focus on strengthening, supporting, and mobilizing communication and partnerships, creating, championing, implementing policies, plans, and laws, thinking about things from a legal and regulatory framework and using that to inform related actions, and enabling equitable access to different areas of public health and different services there. And then when we think about assurance, that's moving us into things like building a diverse and skilled workforce, improving and innovating through evaluation, research, quality improvement, and building and maintaining a strong organizational infrastructure for public health. So collectively, really represents what public health does at a granular level. But again, folks should be able to see themselves in this framework and really think about how they play a role in advancing public health as a whole, in addition to integrating equity throughout all those concepts. So the second key framework we're going to talk to y'all about today is the AFPHS 6Cs framework. If you've been attending these trainings, you hopefully have a general sense of what that looks like. But of course, it's going to draw a nice parallel to the 10 essential services, and we'll talk about that as the crux of our conversation today. So the first C in the 6Cs framework is creating and leading policy systems and environmental changes with a focus on improving older adult health and well-being. Becoming an AFPHS champion is obviously a key step in developing those leadership skills for healthy aging specifically. Our second C is around connecting and convening multi-sector partners. And this is again focusing on the health, social needs of older adults and using more of a collective impact approach to focus on social determinants of health and other non-medical health related needs for older adults. The third C is about coordinating existing services and supports. So not necessarily, recreating the wheel as much as aligning things that already exist to really help older adults, families, caregivers navigate, access different supports and services, and again, promote more of an integration across systems of care. The fourth C is collecting, analyzing, translating relevant data, and doing that with ideally relevant and robust data to make sure that we're doing this in a way that really informs the needs and assets of a community and informs different interventions through community-wide assessment. The fifth C focuses on communication and specifically communicating important public health information. And this is again a focus on not just sharing how we support and promote older adult health, but really thinking too about how we conduct, disseminate research findings, thinking about best practices so that it's kind of a bi-directional concept about sharing what's important, but also listening and learning about what's important too. And the last C is complementing existing health promoting programs to make sure that they're adequately meeting the needs of older adults specifically. And so on the right-hand side, there's a graphic of our framework. You can see that similar to the 10 essential services, equity is the crux and the centerpiece of the 6Cs, and recognizing that we can't do all of that work effectively without understanding the intersections of what it means to experience healthy aging, along with all those other Cs that we've mentioned. Next slide, please. So the goals for this training are threefold. The first is we hope to highlight what those alignments look like between the 6Cs framework I just shared, as well as the 10 essential services. We also want to demonstrate the value of the 6Cs framework and specifically thinking about how we guide healthy aging activities and within the context of historic public health roles. Because, of course, one of the main points of this work is to ensure that we are um, aligning those traditional aging services and different needs for older adults with where public health can step in. So ideally, being able to see yourselves not just as a public health practitioner, but also as someone who's a practitioner supporting and leading aging work. And then third, making sure that we can inspire and advise health departments across the country in their AFPHS efforts. Next slide, please. So this next slide is a bit of an overview to help inform our issue brief that was published a few months ago. As Karan mentioned, the title of the brief is called How the 10 Essential Public Health Services Align with the AFPHS 6Cs Framework for Supporting Healthy Aging. There is a link in the chat in Zoom if you'd like to peruse it today or at your leisure. And as you can see, there's a graphic there that shows how the 6Cs framework aligns with some of the key components of the 10 essential public health services. So within each of the Cs, you will see at least one, but often two, of the 10 essential public health services that we're going to discuss in a little bit. Next slide. So why did we think that it was important to align these frameworks? One is certainly a long-standing one. This next one, the 6Cs, is a little newer. Again, we want to focus on equity. As I alluded to before, spoiler alert, both frameworks aim to center equity in what it means to not just support public health, but of course, older adults. So it's a necessary component and overarching goal to this work. Importantly, public health has a familiarity with the 10 essential public health services, but public health hasn't always been fully engaged in healthy aging. And so those gaps in policies and programs across the life course are often missing. And that's really critical to consider. We also know that those frameworks have common concepts. I talked about equity, of course, but thinking about those necessary and overarching components to the work. We talk about population focus here because it's important to understand how the public health sector can expand that population health approach. And both of the frameworks have that. We believe the 6Cs can serve as a tool for public health to expand its population focus to include older adults specifically. And that currently, as we've alluded to so far, has been missing in the larger public health sector as a whole. We also want to make sure to highlight that there is actually a lot of shared language between the two frameworks. You might have picked up on that a little bit as I walked through them briefly, but it makes the 6Cs concept that has emerged from age-friendly public health systems a little more relatable to public health. We think that that language is, again, not just shared, but could also be applied to other underserved populations. So because equity is centered, 6Cs obviously highlights older adults, but we also understand the intersections and other communities within the older adult population. They both provide guidance for public health policies, programs, services, resource allocations, et cetera, because they both provide very specific opportunities and language about how public health can integrate some of these activities and specifically how older adults can be incorporated in these efforts. And then lastly, we think it's important because it helps us raise awareness around roles in healthy aging and how it can result in new partnerships. So I mentioned before that 10 essential services, ideally you can see there kind of where you fit. We want that same perspective of fit within the 6Cs framework too. So for example, if both of these are aligned, ideally folks can use that information to improve access to services for older adults, enhance and support addressing social determinants of health, and also mitigate the effects of ageism. And we also recognize that the convergence of both fields intentionally can do that. Next slide. So this slide just shows you a preview of what Megan's going to talk about in a lot more detail in these next slides. I mentioned before that each of the 6Cs is going to be aligned with one or two of the 10 essential public health services. And so this is just kind of a preview of which ones we've aligned. You can probably see just from this initial slide, again, that shared language and shared intent across two different frameworks and the opportunity to align not just those language, but the partnerships and the potential strategies that can be used across both public health and healthy aging as a whole. So with that, I will turn it over to my colleague, Megan, who will dig into a little more details about what that alignment looks like and opportunities to move the work forward. So thanks, Megan.
Thank you, Priyanka, and welcome everyone. Good to see a lot of familiar names and new ones as well. So I'm really happy to have everyone here. Next slide, please. So I am really happy to have this opportunity to dive a little bit deeper into these alignments, the alignments between the two frameworks. And I'm going to provide some specific examples of these alignments as well. But as we're moving through the presentation today, we would love to hear some additional examples from you all of how you see your work or you see healthy aging aligning with the essential services. And before I go too much farther, I do want to acknowledge the work of the TIFA intern from last year, Maya Burrell. Maya did an amazing amount of research and thinking to do this, kind of give us this background of for the brief and for the alignment work. It was part of the work that she did for our internship and for her schoolwork, finishing up her master's in public health. So I just really want to acknowledge Maya and all the great work that she did. So our first C, of course, as Priyanka said, is creating and leading policy systems and environmental changes to improve older adult health and well-being. This leadership component, we have learned in our work, is crucial to advancing healthy aging in all sectors and at all levels. And when we look at the tenets of the 10 essential public health services, the leadership components are under policy development, although I think that we can all understand that it takes leadership to accomplish all of the activities within all of the essential services. But from our perspective, we really see the essential public health services that aligns our numbers 5, developing and championing policies, plans, and laws that guide public health practice. And number 6, ensuring that applicable laws are equitably applied to protect the public's health. So next slide, please. Okay, and there are my arrows. Okay, next one. All right, and now we can go to the next slide. So this is our first, okay, go back one. For their first example is reflected in the New York State Department of Health's Healthy Aging in All Policy strategy, under which healthy aging became part of the state's prevention agenda, state health improvement plan, and state officials' commitment to helping communities adopt age-friendly practices across the state. The Healthy Aging in All Policies strategy clearly falls under Essential Service 5, developing policies that guide the practice of public health, and 6, ensuring that laws are applied to protect the public's health as reflected in the state's health improvement plan. So this is really a great example of that championing, that taking the lead on establishing a policy that really filters through so many activities across the state agencies and the top level hierarchy in New York. Next slide, please. So one of the public health sector's traditional and well-known roles is in connecting and convening partners and leaders from various sectors and bringing a focus of prevention and community-wide improvement to a myriad of state and local government policies and practices. So applying a healthy aging lens to this role can help break down silos and promote that multi-sector action, multi-sector collaboration that we know is so effective, especially in trying to address what can be really complex health and social needs of older people in our jurisdictions. And I just want to mention that even though connecting and convening can also, there's kind of some overlap with C1 in the leadership one. This is distinguished from creating and leading because it can represent the next step in turning collaboration into collective impact, with really being intentional about establishing some common goals for healthy aging. So state and local health departments can apply the healthy aging lens to activities that fall within essential service number 4, strengthening and mobilizing partnerships. And although building a skilled workforce in essential service number 8 may not intuitively seem to align with connecting and convening, if you think about the opportunity to enhance the knowledge and capacity for public health practitioners to address healthy aging issues that is so crucial to the life course approach, it really does fall in connecting and convening. We want to connect our workforce with others that are doing healthy aging work to build that capacity in healthy aging. Next slide, please. So connecting state aging service organizations with local aging organizations in rural communities is crucial to providing the kind of support, effective communication, and so forth to ensure that older adults in rural or underrepresented regions receive access to appropriate and affordable care. Some geographic settings, like rural and frontier, represent unique challenges to healthy aging. So our example is from the frontier lands of Colorado, where the Rocky Mountain Rural Health Agency, and they were a speaker at one of our trainings a couple of years ago, helps, and it was, the training was on transportation, so a really appropriate example here. So the Rocky Mountain Rural Health Agency helps to connect older adults with mobile clinical services. They also provide provider navigation services and support, advanced care planning, food services, and more. So they partner also with the Colorado Community Health Alliance to increase uptake in Medicaid services, including the use of non-emergent medical transportation benefits. So you see there are a lot of different ways to connect partners and to connect your partners with the people and the older adults in need in your community. And so this is one way that that's happening in Frontier, Colorado. Next slide, please. The public health sector can also play a crucial role in helping older adults, families, and caregivers understand and navigate our complex system of services and programs that support their health. We always want to recognize the importance and the value of our country's aging services network, which is the state units on aging, our departments of aging and disability, our area agencies on aging, and our community-based organizations that have for years provided crucial services and supports for older adults across the country in all settings, including meals, transportation, home repair, legal services, and others. But this system is complex and it can fall short in meeting all the needs for all who need help. And we know that the need for these services keeps growing. We saw a huge uptick in application for services, eligibility for services. And as our older adult population grows, this demand is just going to get bigger. Another factor that I really want to bring up here that underscores the value of public health engagement in coordinating services are the effects of poverty and racism on health. The public health sector's deep commitment to addressing these systemic factors of health can improve health over the life course and potentially reduce what we are coming to call the cumulative impact of inequities and health disparities as we age. The public health sector can and should help to coordinate programs and services for older adults while still recognizing and acknowledging the important roles that the aging services sector plays in meeting older adult needs. And we think about essential service number 10 when we're thinking about coordinating, and because number 10 is about developing an understanding of the broader organizational infrastructure and roles of the entire public health system. And the way we sometimes think about the public health system, it does include our partners that provide services and supports in the community-based organizations and AAAs and so forth. So there really is a good alignment and kind of thinking about this with a healthy aging lens. So next slide. And we'll talk about the example. So our partners at the Tennessee Department of Health have created this healthy aging website that serves as a hub of information on programs and services for older adults and caregivers. Because caregiver support programs are in such high demand, but information about them can be hard to find or hard to navigate, this website offers just a really broad array of information, and you can see that I know it's hard to see on this slide, but links to services like physical activity, fall prevention, preventive services, nutrition, and so forth. So this is a really important and fairly easy lift, I think, for a public health department to, not to minimize the work that it takes to put this together, but we probably don't have to justify too much creating a page like this that really does help to coordinate and think about the services that are provided across a community or across a state that can all be compiled on one easy one-stop shop here. So next slide, please. Now to our fourth C, collecting, analyzing, translating, and disseminating the important data about the older adult population, and not just data about the population, but about their health and social needs. Because of the what we call a multifaceted nature of aging and the variability of older adult needs and challenges, it's important, it's essential to have data to provide public health departments and practitioners with the information that can inform the development of your priorities, as in your community health improvement planning, and for the targeting of resources. And it's the data that can reveal inequities in access to healthcare or disparities in health outcomes that can both justify and inform the development of programs designed to improve health and well-being at all levels and among a number of vulnerable populations. So this public health activity aligns with both essential service number 1, specific to collecting data, and next arrow, number 2, looking at root causes of health status. Okay, and the next slide, please. So for those of you who know the AFPHS team, you know that we are very proud of our collaboration with the Florida Department of Health. And I know there's some folks from Florida on the training here today. Welcome. And so our collaboration with the Florida Department of Health and the Florida Department of Elder Affairs led to the development of the Aging in Florida dashboard. They were originally Aging in Florida profiles, and a couple of years ago went through an evolution. It's now the Aging in Florida dashboard. We consider this site to be the most comprehensive data dashboard on older adult health and well-being in the country, although California is not far behind, and other states are working to catch up as well. So this is a sample of available data from Alachua County, and this data dashboard has data available for all 67 counties in Florida. So this one, I'm just starting, I pulled a couple screenshots just to demonstrate the huge array of data that's available here. But this starts with population estimates. And then next one, distance from a grocery store. And then we have falls and the occurrence of falls and fall related injuries. And finally, I've pulled up a chart that shows leading causes of death by race and ethnicity. So you can see the value, or you can kind of infer the value of this data in terms of thinking about where you want to establish programs, which communities, which populations that you need to address, and thinking about working with policymakers, working with partners. This data is really crucial to kind of developing all the justifications that you need for more funding or for elevating certain areas and certain issues as priorities in your jurisdiction. So next slide, please. Okay, communicating. The role of communicating, as Brianka said earlier, is crucial. And the public health role is both historic and foundational in communication. So now we are very firmly believe that the public health sector must expand this communication role to include healthy aging, not only for those most affected, older adults themselves, but also to raise awareness of the public health sector's roles in healthy aging. And that includes building partnerships and advocating for stronger and more sustainable public health infrastructure that supports healthy aging. So essential public health service number 3 clearly lays out this essential role of the public health sector in ensuring that communications and educational resources are both culturally and linguistically appropriate, including working with partners to create effective materials. And I would say also ensuring that communications are important, are relevant and appropriate for older persons, and are created in a way that's thinking about across the population and across the life course, where many of us rely on the web for our information. Not all older people do. Some like to still see something on paper, and so thinking about how we communicate, what kinds of forms of communication that we're creating, and where we're presenting that information, how we're communicating with it. And as you see in many of the areas and many of our framework sees, and as well the public health services, there is often an overlap of the roles in public health, like leadership and making connections and communication. So we kind of see that with this role as well. Next slide, please. And so for our example, I want to point out here Summit County, Ohio's Gatekeeper Senior Reach program that identifies at-risk isolated older adults in need of support services so they can age in place safely. So you can see that this flyer that was developed by Summit County was kind of clearly that lays out what the services are in a way that is friendly, it's open, and it's kind of showing what is needed without imposing any kind of stigma or negativity, because this Gatekeeper program engages volunteers, sometimes they're older adults, sometimes others, in people delivering meals, suggesting referrals for mental health or caregiving support, but also is used to identify and screen for potential elder mistreatment of older adults. And so that is a very sensitive issue. So if you have a flyer like this that you can distribute, and it makes people feel, a little bit more comfortable, they just have something to look at, someone's not kind of confronting them in their face about it, but they might feel more comfortable responding to a phone number that they see here, where they can be connected with mental health professionals, caregiving support, even geriatricians and psychiatrists. So it's a really interesting and I think important way to communicate with older people in the community. And the next slide, please. So our final C is complementing existing supports and services. And as I mentioned earlier, the Aging Services Network provides a comprehensive approach to serving older adults in communities across the United States. And unfortunately, funding for these services, which comes from a combination of federal, state, and local programs, as well as the U.S. Indian Health Service, remain constrained. They're not, it's not as free-flowing as we would like. And it's just not enough to fully meet the needs of all eligible beneficiaries. In fact, according to Meals on Wheels America, simply maintaining funding at current levels for older adult programs actually represents a funding cut, given the increase in the number of people who need meals at home and in the community. So with the public health sector's commitment to health across the life course, it makes sense to engage in healthy aging when feasible. State and local health departments across the country have shown that they can work to improve older adult health and well-being without a lot of additional staffing or any additional staffing or funding. For example, your nutrition education programs can be adapted for an older adult audience. And as we saw with the Tennessee Department of Health website, public health agencies can help connect residents with all types of programs and services. And this is a way of complementing existing programs and services. So this tenet of our 6Cs framework aligns with essential service number 7, connecting the population to needed health and social services, and number 9, monitoring real-time health status and working with partners to develop strategies in identifying, analyzing, and distributing information. And next slide, please. And we'll talk about our final example. And this is from our friends at the Benton Franklin Health District in Kennewick, Washington, where they worked with the local area agency on aging to create and deliver emergency toolkits for older adults and provide a link to a resource for emergency planning for individuals living with dementia. Though this clearly aligns with essential service number 7, connecting the population with needed services. So we are certain that there are a myriad of additional examples that align the 6Cs with the 10 essential services. And we'd love to hear some of these if you have them. But I just want to say, because I'm just kind of wrapping up this discussion here and close kind of the formal part of our training, that healthy aging as most of you know, because I know a lot of you are already doing this work, healthy aging requires that all sectors join together through an alignment in thinking of a vision, and your vision of healthy aging for your jurisdiction, and collectively working together to support the health and well-being of all individuals across the life course. When we think about that healthcare journey, we have to think about multiple sectors and multi-sector engagement. It's important for the older people, for their families, for caregivers to improve their lives, and also to potentially reduce the cost burden to our healthcare system. So there really is a greater purpose. Well, I don't want to say greater. There is another purpose in this kind of work, and thinking about complementing and coordinating, connecting and convening. And these goals are all aligned with those of the 10 essential public health services, which also seek to protect and promote the health of all people in all communities. So really commend this brief to you. Again, thanks to Maya Burrill for her great work in doing a lot of this, the underlying thinking about connecting and making the providing examples of how the 6Cs align with the 10 essential services. So Karan, we can take down the slides at this point and open up the presentation, or open up the training today to discussion, questions. Brianka has some experience as well with implementing some of the 10 essential services, and I know most of you do as well. And so I just wanted to, if you're willing to, if you'd like to come off mute and turn on your camera, we'd love to have a discussion, hear your questions, hear your other examples. I see Jane Carmody from the John A. Hartford Foundation. Welcome, Jane.
You know, thank you so much, Megan. I just thought this was great. It's almost like it's what's needed by everybody that's first learning and getting acquainted with age-friendly public health systems and review of the 6Cs. So thank you very much. It's great.
Yeah, no, you're welcome. I mean, we really feel like, you know, the 10 essential services are such a foundational piece for public health, and used across the board for accreditation, for community health planning, you know, for so many reasons. And so we really did want to provide this crosswalk to demonstrate how healthy aging can easily be incorporated into public health work when it's aligned with the 10 essential services. So really
and I
appreciate
think that's how we first, I think we were at a conference and that first came about. I think Kay Bender said, let's align them. It was great. Thanks.
Kay Bender did. And also I remember talking about this with Chuck Henry, who's the health officer in Sarasota Department of Health in Florida. Also talked about this very early on in the work that we were doing in Florida. So very much aligned. All right, well, hearing no discussion and no further questions or offerings or suggestions of additional alignments, I will turn it back to Karan to close us out.
All right. Thank you, Megan. And I did want to just acknowledge Myra's comment about we include the model and discuss any in onboarding. I think that's obviously very important.
Yes,
right.
thank you.
So again, a wonderful heartfelt thank you to my two, again, unbiased colleagues, Megan and Brianka. And again, the link to the brief is in the chat. Also, I wanted to prepare you all for our July training. Our July training will occur on July 18th at 3 p.m. Eastern Standard Time. You will be able to find this under events section of our website, afphs.org. And the training will actually focus on housing equity. Our colleagues that have written a report on housing equity for older adults from Harvard will be sharing some highlights from their report as well. And if you are pursuing AFPHS champion recognition, please pause if you're viewing this as a recording, or if you are attending live, please navigate to the QR code or use a website listed here to account that you have attended this training. Again, this is if you're viewing it as a recording or if you were here live with us right now. So I will pause for a brief few seconds for those of you that are pursuing that designation. And those of you that don't know about it, please go to our website, AFPHS.org, and look under recognition, and you can find all about the different levels of recognition that we have. And then we have an individual champion designation that is based on attending 6 trainings, whether they be viewing the recordings or attending our live sessions every third Thursday of the month. And with that, we thank you all for attending, and I hope you all enjoyed our session today.
Just a moment. So if you could not close it out just yet, we have Catherine Davis, who has a quick comment and question.
Oh,
So Catherine, happy to entertain that.
Can you guys hear me now?
Yes, I can hear you.
Okay, that took entirely too long for me to figure out. I apologize. But I'm on my phone. I'm just not in the office today, so I can't turn my audio, my camera on, so I apologize for that. But just a little bit about myself. I am the newly designated age-friendly champion for Florida Department of Health in Santa Rosa. So I'm really happy to be here. This is my first meeting, so really excited for it. And just one of the things we're working on right now is pretty similar to the Tennessee Department of Health Healthy Aging website. I'm currently getting all of our resources and services listed out in a document, and we're going to make a pamphlet that we can pass out to our community on age-friendly services that we do have. So that's one of the things we're working on right now. And I did have a quick question. We are pursuing the, well, we've already completed the action plan for recognition, but we are pursuing the advanced recognition. Are there any tips or anything you have, since I'm newly in this position? Is there any tips or anything that you have that, or anyone has that thinks that can get us to that point?
Yeah, so I'm happy to respond, Catherine, and congratulations for being designated to become a champion and for participating in the recognition program. So I would say, think about some programs or activities that are already happening in your community and getting engaged with them. So because to achieve advanced recognition, the activities have to be initiated or completed. So you have to be like engaged in them already, not just planning them. It needs to be a step beyond the planning stage. So so Karan and I are happy to meet with you separately, or if you have an action plan you want to share with us, we can provide some feedback on it, if that would be helpful. Or if you're looking for activities, we can send you some sample action plans as well that have achieved advanced status. So any of those, if any of those options are helpful to you, we're happy to follow up.
Okay, perfect. Yeah, we actually they began working on the action plan before I started. So I've been kind of putting it all together, and it does appear that we have actually initiated and completed all of the action plans.
Awesome.
So we're just waiting on our submitting it to our communications department before sending it to you guys. So if everything is completed and it looks good to you guys, is that just the step for us to get the recognition? But of course, we don't have to talk about that right now. I can meet with you and Karan at a later date if possible. But yeah, I don't want to take up too much of your guys' time.
No worries at all, Catherine. Really happy that you joined us today for your first one. Please feel free to go back and look at some of our other trainings. They are, if you go to our website at AFPHS.org and go to the events tab at the top, you'll see a link to previous trainings. So feel free to take a look at some of our previous trainings over the last few years. We've had some really interesting topics, cover a lot of area on the 6Cs, as well as the social determinants of health. So if any of that is helpful to you, yeah, we commend all those trainings.
Okay, perfect. Yeah, thank you. I really appreciate it. Thank you.
Yeah, we'll look forward to seeing your action plan. We'll review it quickly and get back to you.
Thank you. I appreciate it.
Okay. All right. Thank you, everyone.